How can patients and caregivers cope with the emotional impact of stem cell transplant types? Facing a stem cell transplant can feel overwhelming, especially when you consider the intense process involved. Whether it's an autologous transplant, where your own stem cells are used, or an allogeneic transplant, which involves donor cells, the journey can bring a lot of emotional ups and downs. These procedures are often used for conditions like non-Hodgkin lymphoma when other treatments haven't worked or the disease has come back. They involve high-dose chemotherapy or radiation, followed by the infusion of stem cells to rebuild healthy bone marrow. Because of the complexity, potential side effects, and uncertain outcomes, it's natural to feel anxious or stressed. One of the best ways to cope is to learn as much as you can about your specific transplant. Understanding what the procedure involves, the possible benefits, risks, and complications helps reduce fear of the unknown. For example, knowing that allogeneic transplants carry a higher risk of graft versus host disease compared to autologous transplants can help set realistic expectations. When you understand what might happen, you can prepare mentally and emotionally for the journey ahead. Open communication with your medical team is also crucial. Regularly talking with your doctors, nurses, and transplant coordinators allows you to ask questions, share concerns, and get personalized information. This builds trust and helps you feel more in control of your treatment decisions. Don't hesitate to express your fears or uncertainties. Your healthcare team is there to support you. Seeking support from mental health professionals experienced in oncology can make a big difference. Counseling or therapy can provide coping strategies for stress, anxiety, or feelings of grief that may come up during treatment. Joining support groups, whether in person or online, connects you with others who are going through similar experiences. Sharing stories and advice can lessen feelings of isolation and reminded you that you are not alone. Practical planning can also ease emotional strain. Organizing your hospital stays, medication schedules, and home care routines helps you feel more prepared. Caregivers benefit from clear plans too, which can reduce their stress and help them manage responsibilities while also taking time for their own self-care. Incorporating mind-body techniques such as mindfulness meditation, breathing exercises, or gentle physical activity can help manage emotional distress. These practices promote relaxation and improve overall well-being, making it easier to handle the emotional roller coaster of transplant recovery. Setting realistic expectations is important. Recognize that recovery can take time and setbacks may happen. Celebrating small milestones along the way can boost morale and foster resilience. Remember, every person's experience is unique, and progress varies from one individual to another. Finally, taking advantage of resources available at specialized cancer centers can provide additional support. These centers often offer comprehensive care, including psychological and social services, tailored specifically for stem cell transplant patients. Engaging with these resources can make the process feel less daunting. In essence, coping with the emotional impact of stem cell transplants involves a mix of education, open communication, emotional support, practical planning, and self-care. Both patients and caregivers benefit from a team approach that addresses not just the physical aspects but also the emotional and mental challenges. Always consult your healthcare providers for personalized advice, and remember that maintaining hope and resilience plays a vital role in navigating this complex journey.